Health is the default, and this is really important because you are enough.
Hello everybody, welcome to another episode of Dr. K's Sunday Special. Today I have one simple question for you. Is your head on straight? I'm an upper cervical chiropractor and I see patients every single day, and I'm going to show you 3 ways that you can tell for yourself at home if your head is on straight or not. When we're talking about head and neck alignment, what we're really talking about is the positioning of the very top bone in the neck called the atlas bone. The atlas bone is a 2-ounce bone that connects the bowling ball of the head onto the rest of the spine. And what's really interesting is that there's no discs or interlocking joints or any fusion between the atlas and the skull and the rest of the spine, which means there's 360 degrees of possibility of how the head and the neck can misalign at that atlas bone. So 3 ways that we're going to be able to determine if your head and neck are in alignment. Let's dive into way number 1, which is asymmetry. And this is asymmetry within your body. So a really simple exercise for you to do at home is to stand in front of a mirror, close your eyes, shake it out gently, and then slowly open your eyes. And without moving, I want you to take note of a couple things. First, I want you to look at the tips of your shoulders and see if they're in line with each other. What you might notice is that one shoulder is sitting higher than the other, and your arms hanging down, one hand is lifted up relative to the fingertips on the other hand. And you'll see that your shoulders and your arms, and even your hips, if you take notice, have this slant to them. And what is most likely happening is that the atlas bone has lost its relationship with the head and the rest of the neck. And the most powerful reflex in the body is called the riding reflex. It's also called the riding mechanism. And here's how it works. If the atlas bone is misaligned and your head is tilted, nobody walks around like this. The way you actually walk around reflexively is like this. Your body, using the inner ear for balance and the eyes for the horizon line, will actually self-correct and right itself on how it carries itself in gravity. And it will sacrifice the alignment of the shoulders and of the hips to keep the head and the inner ear vertical. Because otherwise, people walking around like this, you'll have vertigo, the whole room will spin, you'll start to get nauseous. The body doesn't like that. So it'll actually correct the alignment of the head and sacrifice the alignment of everything below that point. So if your shoulders are off, if your hips are off, if you notice that one side of your body is tighter than the other side, maybe you have one side hip that's tight or one-sided knee pain in the absence of injury. If you have these weird body asymmetries going on, especially in muscle tone and in contraction, this might be something that's going on and worthy of looking into. Number 2 way that you can tell if your head and neck are misaligned, the presence of headaches. And when I say headaches, I mean literally your head aching. So this can mean tension, this can mean a true headache or a migraine, this can mean brain fog, ringing in the ears. Any way that your head is aching can be a sign that your head and neck have lost its relationship with each other. And the purpose of this, what really causes a lot of this problem, is the changes in blood flow and cerebral spinal fluid flow in and out of the skull. When the head and neck misalign, you change the way that your heart pumps the blood up into the skull. That pressure change and that different tension feeling can cause a lot of the headaches that people are experiencing. I see this all the time in my clinic. So if you find that your body is twisted up and you're very asymmetrical, and maybe you also have headaches going on, this can be another big way of telling if your head is on straight or not. Number 3 way, sleep issues. And this is actually really interesting because the head and neck alignment, when it's twisted, puts a stress on your nervous system that is going to shift you more towards a fight or flight response. For those of you familiar with how the nervous system works, there's 2 opposite ends of the spectrum as far as autonomic or automatic nervous system function. What is your nervous system doing when you are not consciously thinking of it? When you're digesting your food, when your heart is pumping, when you're breathing, when you're blinking, things of that nature. And when you have a head and neck misalignment, it's going to shift you more towards a state of stress. the fight or flight response, the mechanism that's going to increase your heart rate, increase your blood pressure. It's going to stress your system in such a way that when you lay down at night and try to quiet your system, if you have a big asymmetry, if you have a big twisting in your head and neck alignment, your body's not going to be able to shift yourself towards the relaxed state as easily. And I'm going to be going into this topic more, the autonomic nervous system topic, in next week's Sunday special, so definitely be sure to tune into that. But these are 3 ways that you can tell for yourself at home that might be a good indication that your head and neck are misaligned. And if so, you definitely want to go and look that out from a qualified doctor that's really trained at looking at these specific alignments between the head and neck. The picture over there looks pretty dramatic. Oftentimes we're talking 4, 5, 6 degrees of separation. So little minute details as far as the misalignment can mean big time changes in how your body's able to function. So definitely pay attention to this. And if you need to go get your head checked to make sure your head's on straight, definitely do so. I hope you find this information valuable. I hope you can take some of these topics and some of these understandings and apply them in your own life so that you can become healthier and so you can start moving towards a state of better health. So until next time, this has been an episode of Dr. K Sunday Special. Thanks so much for joining.